Many have struggled to understand the dissociation curve, and quite honestly, instructors have had a difficult time teaching it. Let's stop complicating the simple. The dissociation curve is a great and simple tool for every practitioner. First, the curve reveals that as you apply more pressure in oxygen, it will saturate or occupy a greater percentage of blood. We see that here. More pressure equals more saturation. You can even make some predictions. For example, if the oxygen is pressurized to 60, it will saturate about 90 to 92%. If the oxygen is pressurized to 80, it will saturate about 95% of the blood. That is why, in general, we want the pressure of oxygen to be between 80 to 100, because the curve reveals to us that this amount of pressure saturates the most amount of blood. What we don't want is for the pressure of oxygen to decrease below 40. That's where saturation decreases drastically, and that's not good. That's called dissociation. Oxygen jumps or dissociates from the blood. As a side note, there's also some landmarks that you should learn, like the P50. The P means percentage, so the P50 is the 50% saturation mark. And the question is, how much pressure is required to saturate the blood to 50%? Answer, 27 millimeters of mercury. And so the P50 is normally 27. But what if the graph shifts to the left? Well, if the graph shifts to the left, you will notice that one positive thing happens. The blood becomes more saturated with oxygen. However, if the oxygen is in the blood, it must not be in the tissues, and we call that hypoxia. So then, what can cause a shift to the left? First, cold slows down transfer. So if the patient has a decrease in body temperature, oxygen will not transfer effectively to the tissues and will remain in the blood. What else can cause a shift to the left? Well, if there's more oxygen in the blood, that must mean that the enemy of oxygen must not be in the blood. Therefore, a decreased CO2 level in the blood can also cause a shift to the left. How does someone have reduced levels of CO2 in the blood? Answer, they blow it out. And that's called hyperventilation. And a drop in CO2 causes a rise in the blood pH. And this is called respiratory alkalosis. So what if the graph shifts to the right? Well, if the graph shifts to the right, you will notice that less oxygen is in the blood, and we call that hypoxemia. And what can cause a shift to the right? First, if a patient has a fever, the tissues will require more oxygen. Also, if CO2 levels rise in the blood, then oxygen will be forced to go to the tissues. How does the CO2 level rise in the blood? Answer, you don't blow it out, and that's called hypoventilation. And a rise in CO2 level causes a decrease in the blood pH, and this is called respiratory acidosis. So the goal is not to allow the graph to shift, and if it does, you can correct the CO2 and or the temperature to help bring the graph back to normal. Well, there you have it, the dissociation curve, a fun tool to help you, the practitioner,